Nursing homes say they have had to turn down patients because they simply don't have the staff to take care of them. But it does not just impact those patients or their loved ones.
Yeah, it is a cycle that also hurts hospital capacity by keeping patients there longer. Tonight, WKYT's Garrett Weimer shows us what they're dealing with.
During the pandemic, for all the concerns about hospitals filling to capacity, the worries at many long-term care facilities have often been the exact opposite. Empty beds.
In our skilled nursing facility, we've got nearly 40 beds sitting empty because we don't have the staff to take care of them. And it is scary.
Places like Sayre Christian Village say they're doing what they can as they deal with staffing shortages. For many, that's meant not taking in new patients.
I have an admissions person that all they do all day long is field calls that unfortunately we don't have availability, and that is not what the message that we want to send. But we also don't want to send a message that we can't take care of the residents that we have. So it is a fine, very fine balance.
Then that impacts all of us because it clogs up the healthcare system.
Backing up hospital beds is just one impact. Lost revenue makes it harder for the facilities themselves to stay open. According to a recent survey from the Kentucky Association of Healthcare Facilities, Kentucky Center for Assisted Living, 57% of member facilities are worried they might have to close if staffing problems continue.
It's really a perfect storm, I think, although I'm sympathetic to all areas of our economy and the workforce struggles. We really need to focus on long-term care.
Experts say it's not a new problem, but the pandemic accelerated it. Nationwide, the Bureau of Labor Statistics shows nursing homes have lost close to 240,000 workers. That's 15% of its total workforce. At one point this winter, industry advocates say skilled nursing facilities across Kentucky had roughly 3,000 open positions.
It is beyond a crisis situation.
The state's long-term care ombudsman tells me from July to December, her office received 51 complaints directly related to staffing and 88 complaints about delayed or unanswered responses to requests for help. Both of those categories are up from the first half of the year. But some experts say part of the answer has also been part of the problem. The federal government has been asked to look into staffing agencies. Many facilities are relying on them to fill open spots, only for some to be charged high rates and have their own workers hired away to agencies that can pay more. Meanwhile, lost revenue continues to take a toll even on nonprofits.
While we're not for profit, we're also not for loss. And our COVID expenditures on their own have taken a significant toll on our operation. And so to have beds sitting empty.
Venus says she knows it's not unique to them or even their industry, but it's no less frustrating.
There is a huge need for what we do in this community. Now more than ever, as you have folks that have been in the hospital from COVID, there's a lot of folks that need the services that we provide. It's just incredibly frustrating that we can't do it. And we can, but we've got to have the appropriate amount of staff before we can.
Garrett Weimer, WKYT.
Venus says Sayre right now is about 75% occupancy when they typically be close to 100. She says they're seeing an uptick in applications, but still nowhere near what they need.